So in the first video, we looked a bit about the impact of person-centered care, the dietetics that we understand of it, and the impact of not having person-centered care. And I just want to, in this second video, just give you a bit of an idea of some of the views of dietitians. So a colleague and I did a cross-sectional survey. It was actually in 2018. And it was a follow-up after one that I did in 2007. So cross-sectional online survey, 729 respondents of British Dietetic Association members. So this includes, this is just the full members. It's not including the student members. This is including the full members. So we asked them lots of questions about their views on communication skills, and we've called them communication skills for behaviour change, and because that's what we did in the first survey. And we asked them their views on different things and their skills. So let me just give you a snapshot of some of the results for those. So 99.5% of the respondents said that communication skills for behaviour change were important in dietetic practice. That's music to my ears. That's what I want to hear. And what you'd expect, and it would be quite worrying if that figure were much lower. Then we asked them to rate their own skills. So this isn't a measurement of their skills, it's just how they perceive their skills on a Likert scale from 1 to 5, 1 being excellent, 5 being really poor. So 83.6% rated themselves as either excellent or very good. 16% rated them as poor in the lower half, so not very good skills. So they didn't have high. Nobody actually said they were really poor, but they weren't confident in their skills, or had that belief that their skills weren't very good. So that was a bit concerning, because you would hope that as people have been trained, that their skills were taught to them, that they developed their skills, and if their skills weren't very good, that they would have had some support in the workplace to develop those. So it's almost 1 in 5 not feeling very confident about their skills. And in comparison to the original survey in 2007, where many barriers to implementing training into practice were highlighted, there were hardly any. There was just one barrier to practice, to training in practice in 2018, and there'd been 436 in 2007. There were 1,157 respondents then, so a few more, but even so, there's a very profound difference between the number of barriers to training, implementing training into practice that were raised. One thing that was very important was that people were saying that these days accessing training as qualified staff is very difficult due to financial constraints and the ability to take time off work. And if you bear in mind that this was pre-COVID, pre all the pressures that we're under now, this is likely to have got worse during that time frame. What there was a lot of more openness to use different technologies to support learning. So people were saying that we need a more flexible approach, because much as we'd like to get out of work and go on a 3-day training course to develop communication skills, it's not going to happen. So there was quite some differences there that were quite important. And I just want to kind of give you here some of the gaps and the differences between what happened for those who were trained more than 10 years ago to those who were trained in those last 10 years. So they're a different population in regard to what they might have said on the training that they will have had. So you're coming into training at this point where communication skills are really important. But for those who trained more than 10 years ago, they had a lot smaller emphasis than they do now. So there's been quite profound changes. So you'd expect there to be some differences between these two groups. And if we look at that, these are the statistically significant differences between the two. So we've got those who received pre-registration training in communication skills to support behaviour change. Those who were trained more than 10 years ago, there's less than half of them. Those who were trained in the last 10 years, there's nearly 80%. Very profound difference. Again, a profound difference, but in the other way round. Again, perhaps not to be unexpected either, but those who received post-registration training are much more likely to have happened in those who trained more than 10 years ago than those who trained in the last 10 years. And there's several reasons that might be. One is that from 2007, I mentioned in the NICE guidance coming in and saying we need to train everybody. There was a lot of training went on very soon after that NICE guidance came out in 2007 on behaviour change. But also there was more funding for training during those time. And those who were trained more than 10 years ago, who didn't have communication skills training pre-registration, probably perceived to be in more need of it post-registration. So that difference makes sense. Interestingly, that those who believed they would benefit from more training, so those who've been trained a longer time ago, are less likely to think they need more training than those who've been trained more recently. And that might be an attitudinal difference, because the importance of communication skills has become something we're much more aware of. But it also may be that expectation that, more training is going to be beneficial. We asked people whether they think skills are more relevant to some areas of practice than others. So traditionally, for example, people would say, you need more communication skills if you're working in obesity management or eating disorders or long-term conditions like diabetes than you do if you work on intensive care. So there is a difference there in perception of how important your communication skills are, depending on what area of practice that you work in. And then we asked about whether, we should have skills reviewed once we are trained. So post-registration, should we have some more training? Should our skills be reviewed? And those who trained more than 10 years ago were less likely to think that, whereas those who've trained more recently think, yes, actually, we should have our skills reviewed. But this was talking, is it voluntary or mandatory? And those who have trained more recently feel it should be voluntary, whereas those who trained longer ago think actually perhaps it should be mandatory. Perhaps we should really be checking out whether people have got these skills or not. And just to give you a flavour of some of the comments that we had, people saying, I think it should be mandatory that we have updates and refreshers to ensure we're actually competent and to sharpen our skills, because it's really easy to slip into bad habits. And I know that to be the case. We've seen that in a lot of the post-registration training that I've been involved in over the years. But also I've been in the position where I've trained someone as an undergraduate, pre-registration, and then trained them as a post-registration, and been quite horrified by the difference and the fact that skills have not been maintained. So we can slip into bad habits. There's a view that, we learn basic skills pre-reg and then you develop your skills with experience and practice rather than formal training. And I think there's quite a strong evidence base that just experience isn't enough to develop skills, because of that whole thing about falling into bad practice and slipping into bad habits. So the evidence base, this is someone's view, but the evidence base that just being more experienced makes you better is not there. So we probably need a mixture of formal training, review, peer observation perhaps, to try and continue to develop our skills. This next comment really demonstrates a lot of people's views. We just can't get external courses funded and agreed to, but better if it could be that route. So people recognizing you sometimes need a bit of time out of the workplace to actually stop and think and revisit what you're doing, but it's just not realistic currently. And I think that's a fair point. And the final one, you expect a certain level of ability on qualification, which we do, wouldn't expect this to deteriorate significantly, and believe that presently other priorities are more important. And that's an interesting one which you could debate. They don't expect your skills to deteriorate significantly. I would question that from an evidence-based perspective. And they're seeing other priorities are more important. And another study that's been done has identified that people tend to think it's more important to keep your knowledge up to date than your communication skills. Whereas actually you really need both, because you can be the most up to date in the knowledge, but if you can't communicate it to your patient or you can't engage with your patient, it's really of no help. So you've got to be able to do both. We need to keep up to date with our dietetic skills, our knowledge, but we also need to keep up to date and make sure that our communication skills are continuing to improve. So just to finalise this then, we need health-related behaviour change to happen with our service users for health improvement. We've got to focus on being person-centred and a personalised approach, not a disorder or disease-centred approach if we're going to support behaviour change. If we're going to deliver person-centred care, we need to develop good communication skills, because these are the foundation of what the other skills, the behavioural approach, the person-centeredness, things like motivational interviewing, they are all based on the foundation of good communication skills. But there are a range of skills and strategies that we can use and develop later on, and we'll talk more about those in the second year. But actually, we need post-registration training to further develop our skills as we get used to actually working under the pressure of the workplace. So I've given you a lot of references and further reading at the end of this slide set, which will be on Moodle. There's just a few of those papers you can go and have a look at if you want to, but I'm certainly not expecting you to read all of them, but I would like you to know where to find them.